he is having T12 spinal cord injury. So for him, he will be having probably the paraplegia. Okay, so we may not know which muscle is spared, and like we are checking the level of spasticity, degree of the spasticity. So while checking the degree of spasticity, right, we have to position the patient according to the muscle that we check, right? So now I have selected the muscle hip abductors. Okay, for hip abductors, supine lying would be the appropriate position. Okay, so after making the patient to be in supine lying, so we have to handle the patient's leg as we do the passive movement, because we are going to do a quick passive movement to see where the spasticity is. Okay, so what is spasticity? Spasticity is increased muscle tone in either agonist or antagonist. Okay, so it will not be in both groups, right? If it is in both groups, then what do we call it as? Rigidity, right? So if the tone is increased in both in agonist and antagonist, then rigidity. So this may be in either agonist or antagonist. Fine. So after positioning the patient, so anyway, we have informed the patient already what he should be doing. Okay, so I'm going to test this limb. Okay, so you're not, you just be relaxed. Okay, don't do anything. Okay, fine. So just hold the limb in the position. Okay, so there are different types of holdings. Okay, the holding should be comfortable for you as well as the patient. Okay, so one hand is supported under the knee joint. Okay, the other hand I'm supporting it under the ankle. Okay, so now which hand is going to move? Which hand I'm going to move? Yeah, distal. This is for support. That's it. This is for support, and this is going to move. Okay, so and you have to select a position in a diagonal way. Okay, and you have to make yourself clear. Okay, and what is the normal range of the motion for the hip abduction? You should be very clear about the normal range of motion as well. Okay, what is the normal range of motion for hip joint? For male,
0 to 60.
60.
60.
Female,
Slightly wider.
yeah, but it wouldn't be 60. 45. Yeah, right. So you have to do a quick movement. Okay, you have to do quick movement, and you have to observe, and we are not going to do it again and again for a long time, right? So say example 3 to 4 times is more than sufficient, but you have to pay attention. It's a kind of feeling, right? You will feel where the catch is, okay, and how it is restricting. So already you have instructed the patient, right? So fine. So here what you have to do is, after positioning, hold the leg appropriately and perform the passive movement, which is quickly, to design the tone, and stabilize the segments properly and ensure the safety of the patient, right? And then, so grading, so we have to mention the grade from 0 till 0, 1, 1 plus, 2, 3, 4, like that. We have to mention the grades. For example, if I am grading it 0, obviously there is no increase in the muscle tone, which means flaccidity, right? So I can confirm that if the muscle is moving freely, flaccidity, then I can confirm that he is still in the stage of spinal shock, right? So, and one slight increase in the muscle tone manifested by a catch and release, right? By minimal resistance at the end of the range of motion. So which is the end of the range of motion? So this is the end of the range of motion. There is a minimal catch in the end of the range of motion. Okay. So like that, and 1 plus slight increase in the muscle tone manifested by a catch followed by minimal resistance throughout the remainder of range of motion, right? And 2 most marked increase in the muscle tone through most of the range of motion. Okay, so everything you have to tell and you have to demonstrate. For example, if it is 2, then I will be feeling the resistance through most of the range of motion. Right? 3, considerable increase in the muscle tone. Passive movement is going to be very difficult to perform. And 4, affected part is going to be rigid, either in flexion or extension. So like that, you have to tell and interpret the result. So interpret and tell what is the final result. For example, sometimes I may be instructing the model to catch only at the end, right? Something like that, right? So this is the one. Okay. For example, if the patient wanted to be tested for his hamstrings, okay, how will you hold?
Prone position.
Okay, so make the patient to be in prone position. Okay, so can you please? Oh, yes, please. Yeah, any like this.
So one hand will be stabilizing the pelvis, and other hand will be holding at the distal part of the thigh, like
This is for which muscle?
hamstring, like.
Sorry.
Hey, hamstring. Sorry.
Yeah.
Sorry, sir.
No problem.
This one. Like this.
Okay. What I would suggest is rather holding one hand under the knee, just leave that. Okay. You can make a towel roll. Oops. Just towel roll. Why? To clear the. You can do without towel roll also, but with towel roll, it is going to be a bit easier for you. Right? So this and that's it. Because in passive movement, you are going to do it slow, smooth, and rhythmic. The same thing you are doing, quick passive movement. Just. Okay. Paining? Because I could feel, because his patella is not stabilized. So when I'm doing it, I could feel that patella is moving. He should be having, yeah? Yeah, maltracking is there. Okay, fine. How will be doing for, what is the position you will select for cuff? Calf muscle. Is it comfortable to make the spinal cord injury patient to be high sensitive?
The leg over the edge of the table.
Okay.
The prone is fine. Either and position alter whether you want test for the soleus or the gastrocs.
Generally, because you can't isolate the muscle when you're checking for the tone.
Yeah.
Generally,
prone is fine.
so in prone, how you check?
The leg put it at the edge of the table.
Edge of the table.
Then
Okay.
bundle flexion.
Okay. Any other position? Any other position you select?
Soleus.
Make it simple and easy for you to do as well. You should be able to do the quick passive movement. So what Heng was telling, okay, I agree. But if done that, I have another position which is comfortable.
Flexion to 90 degree.
That's it. Okay. That's it. Flex the knee to 90 degrees and make sure that whether you can able to flex, because its plasticity is there, in the hamstrings, then flexing may be sometimes difficult, right? So make sure that you can able to flex. Okay, then
So that one is dorsiflexion.
yeah, dorsiflexion and plantar flexion. both together, because even in this position also we are going to, no, he is having some issues. You have any pain here? No. So because the movement, it is not smooth.
Facial adhesions.
Okay, so you can do this. Can you hear some clicking? Okay, so this way you can do, and you can find it out. And hip flexors. What is the position you select for hip flexor? All the other procedures are same. Just the position and how you are holding it.
Supine.
Okay, supine position. Okay, can you please be on your back? Okay, yeah, in supine, how you do? Can someone show please?
Like straight leg raising.
Straight leg raising. Okay. Can someone show how you will be and how much degree you will select?
135.
Yeah.
135.
In straight leg raising, is it going to be? It's going to be really very hectic. So can someone hold and do it? Maybe in short arc. Try in the short arc. Because if the patient is having rigidity only, you can't able to flex actually. With spasticity, yes, you can. Can someone? Can you try? How will be the hand placed in this? Okay. So which hand will be the moving and the other one is supporting? Okay. So is it the is there anything is missing? Is the safety is it missing?
And now start.
Yeah. Should be a quick movement. Yes. But what I would suggest is just try to move your hand while you're doing it. Yes, it is heavy. Yeah. Okay. So while you're lifting, just put one hand under the knee. Okay. And try to maintain the position, and you should be able to move it. Okay. And that should, in the spasticity evaluation, you have to just do it quickly. Then you can find it out. Okay. So you can able to see the movement of the hand, right? So why am I moving this? While I'm moving up, I'm just avoiding the blocking of this movement. Okay. While I'm bringing down, I'm supporting the limb. Okay. So and it should be quickly moved. Same thing in the passive movement. We are going to do slow, smooth, and rhythmic movement, right? But in this, the same thing, quickly doing it. That's it. Okay, fine. So we saw hip flexors, then knee flexors, and ankle. Yeah. So that's in T12 spinal cord injury. These are the muscles you have to check for. Okay, if it is upper limb, accordingly you have to modify. If it is biceps, then hold it like this, right? Okay. This. But if it is a passive movement, slowly you'll be doing this. That's it, right? A quick movement. That's it. Okay. So is it clear for you how to? Yes.
The great toe extension.
Sorry.
Great toe extension.
Great toe.
For alpha.
L5. Yeah.
How to check alpha? The great toe extension.
Just go for the group of muscles rather going individually. Like we were measuring, we were like looking for dorsiflexors and plantar flexors, right? So like that is enough. So no need to. If you go individually, it's going to be bit difficult actually. So nothing to worry about it. Okay. So next one is going to be the so example if the question is something like partial paralysis of inspiratory muscles due to the third cervical spinal cord injury. What is the link between the third cervical nerve and breathing?
Feeling
3, 4,
for the
5.
diaphragm.
Yes.
Training.
3, 4 and 5 is supplying diaphragm, right? So if 3 is affected, then obviously there may be, not maybe, surely there will be difficulty in breathing, right? So the muscle weakness will be there, right? So here what you have to do is inspiratory muscle training we have to do, right? Inspiratory muscle training along with the diaphragmatic strengthening, right? So as usual the procedure starts with introducing yourself and explaining the procedure. So here what you will be explaining to the patient? What will you be explaining this to the patient? So in cardiorespiratory you might have studied, right? Inspiratory muscle training and diaphragmatic strengthening. So here what you are going to do is you are going to divide the task into two. One set is inspiratory muscle training, next will be the diaphragmatic exercise, right? So what instruction you will be giving to the patient? So we can tell that I'm going to give you some exercise that will be helping you to breathe normal, okay? Based on the level of injury and percentage of injury, you can tell I'm going to help you to breathe well, okay? Don't do false promise completely I'm going to make it. No, don't do that. Just put the word in such a way that it is going to encourage the patient, okay? So I'm going to help you to strengthen the breathing muscles, okay? And so we have to place a towel roll below the neck to support the cervical arch, okay? Don't go for pillow. So it creates a cervical flexion, so that will restrict the movements of breathing exercise, okay? So place a towel roll, okay? So obviously that helps maintaining the arch. Are you comfortable? Okay. So after that, so you have to justify the patient in this scenario has partial C3 spinal cord injury, which may cause partial weakness. So these are all the things you will be justifying to the examiner, right? So why you have selected this condition? Why? Because if C3 is involved, there may be the chance for him to have partial weakness, okay? And patient position, what position you will be selecting?
Fowler's position.
Fowler's position, semi-Fowler's position, supine position, or side lying, okay? So you can select the position accordingly, okay? And yeah. Fine. So if you wanted to do the patient in crook lying, what is the justification you give? Why you wanted to bend the knee?
To prevent stretch over the abdomen.
That's it. Okay, it helps preventing the abdominal stretch. It reduces the pressure, intra-abdominal pressure. It relaxes the muscle. Alright? So diaphragmatic strengthening. Place the dominant hand below the inferior angle of the ribcage and the sternum. Okay, so you can place the hand like this. This is the strengthening exercise. Okay, so what you can advise is make the patient to turn the face to one side. Okay, breathe out through mouth, through open mouth, while the patient is breathing out, you just try to give a pressure downward. Why? Because this help you to stimulate the muscle to contract better. Okay, because a stretch, right? A stretch will be stimulating the muscle to contract better. Okay, so when the patient is breathing out, without, okay, take a deep breathe in. Breathe in. While you're breathing in, the abdomen should be bulging out.
So, the performer here is that apply gentle pressure during inspiration.
Apply the pressure during inspiration
To
to
facilitate
facilitate the
the
muscle.
muscle.
Yes. Okay, so this is when the patient is breathing in, right? So while breathing in,
Gives
so we are
resistance.
giving the resistance actually. Alright. So breathe out. Okay. Breathe in. Okay. Breathe out. Breathe in. Breathe out. Okay, here one more point maybe in the column you can add is while the patient is breathing out, right? So you are giving a gentle pressure at the end. Why? It helps in stretching the muscle, because when the diaphragm is stretched, right, it induces the contraction effectively. Okay, so obvious thing is you are giving resistance for that muscle, but at the end you are giving a quick pressure, so that gives stretch. That stretch will make the muscle to contract effectively. I think in that performer one line can be added in that. Okay, later I'll add that. Okay, so applies gentle pressure. Okay, accessory muscle facilitation. So accessory muscles, what are the accessory muscles for the inspiration? Yeah, so sternocleidomastoid,
Back major and minor lats.
that's it. Okay, so like that we have a list of accessory muscles. Okay, so mainly we can position the patient in supine lying, position the shoulder in mild abduction. Okay, so mild abduction, external rotation, so which means that the palm will be facing upward. Okay, mild abduction, external rotation, forearm supination, and palm facing upward. Okay, so yeah, the head and the neck should be in the neutral position. Okay, so place the hand on the chest in the triangular pattern. So instruct the patient to breathe in through the upper chest. Okay, so what you can do is you can place the hand like this. Okay, like this. Okay, while you are breathing in, what you should do is you have to focus on the area where my hand is. Okay, and try to expand that area. Okay, fine. Breathe out through open mouth. Okay, now breathe in, breathe in, breathe in. Okay, yeah, breathe out, breathe in. Right, so we are giving a sensory reinforcement on the muscle. Okay, so the area where he is focusing is on the accessory muscles, because yes,
The patient got C3 vision, right?
yes,
Here the sensation.
because it's a partial lesion, so and at the same time we have to promote the accessory muscle usage, because the patient breathing is affected, so we are stimulating the accessory muscle, encouraging the accessory muscles. In some conditions, for example COPD, asthma, so we will be inhibiting the action of the accessory muscles. You guys remember that? So for inhibiting the accessory muscles, what you will do?
Personal breathing.
Yeah,
Personal breathing.
firstly breathing, and specifically to that muscle, means accessory muscle inhibition. So in the cardiorespiratory, accessory muscle inhibitory techniques you will be doing. So for that, what you will be doing is you will be just placing on that muscle, and you will be giving a pressure to restrict that muscle to work. You understand, right? For example, now I'm facilitating, so I'm just placing the hand and I'm asking him to breathe in, so thereby I'm stimulating the muscle. But if I wanted to restrict or inhibit that muscle, so I'll be placing the hand. Okay, now take a deep breathing. So I'll be giving a pressure, so which makes the muscle not involved in that. It creates a kind of pressure. So that is the inhibitory techniques. So which is anyway that is not applicable here. We want the accessory muscle to work, right? So
exactly at what point or what muscle should we?
so for example, if it is sternocleidomastoid, we will be placing the hand on the sternocleidomastoid.
Just press to it.
Yes. And during the end of the phase, we'll be giving pressure deep. So we'll be giving a push to that muscle. So that relaxes the muscle actually. So inhibitory technique. So places the hand on the chest. Okay, mentions avoid excessive pressure to prevent occlusion of vital arteries. Okay. Okay. So these are all the techniques what you can do. Okay. If the C3 is affected, one thing is like you can strengthen the diaphragm, and you can promote the accessory muscle usage. Okay, by placing the hand on that, and through a sensory reinforcement, you're asking the patient to focus on that area, and patient will be expanding that. Okay, so this is one technique. Okay, fine. So can you guys wanted to just try to practice and see, please?